And men may soon have access to birth control. A form of the contraceptive is showing promise in clinical trials. So I'm joined by family physician Dr. Bijoor with Oakview Medical Associates here in Greenville. And tell me a little bit about how this birth control works, because it's not a pill, it's a gel.
It's a gel, yeah. So it's about time tables turn a little bit.
I think a lot of women are excited about this.
Yes. So, you know, women release one egg a month from the ovaries. Men produce 1,000 sperms per second. So it's about time we have something that's safe, long-acting, and reversible. So this is a gel that is applied, rubbed on the shoulders every day. And what it does is it has two components. One is nesterone, which is a progestin that blocks the production of testosterone from the testes and hence inhibits sperm production. And then there's also testosterone in the gel, which, you know, men need testosterone to help with their lean body mass and to just keep up with their overall health and libido. So they've added a little bit of that to just supplement enough but not overproduce the sperm. So I think it'll be a big breakthrough.
And how long was this study, and how many people were involved?
So I believe this has been going on for the last 20 years. 2005 is when they've had initiatives to look for male contraceptive options. But this current one, I think through the NIH, has had about 300 subjects, 300 men enrolled, and pretty promising results there, and very low side effect profile. So
and that's my next question, because this is supposed to reduce your sperm count. I think a lot of men wonder specifically certain side effects, like what could be the side effects?
Yeah, you know, so normal sperm count is 15 million to 300 million per ml of semen, and studies have shown that you have to bring it down to at least 1 million per ml of semen to inhibit sperm production and prevent a pregnancy. So what they found is the side effects are very low, but they can range from mood changes, some depression, some local irritation at the site of application, and then increase or decrease in libido can happen, and also hair loss and hair changes can occur.
I think the libido is what, some men might be curious about. All right, and then what's the efficacy of this?
So 86% I think were found to meet the criteria of inhibiting the sperm production and preventing a pregnancy with 15 weeks of application, but some achieved the under the range of 1 million per ml within 8 weeks, so it is pretty good. Yeah.
Okay, well, I know 86, hey, a lot of us will take it. It's not quite as effective as female birth
especially
control.
When, you know, pills and female birth control options have a failure rate of 7% and condoms have a 13% failure rate. So we need something much better than that.
Yeah,
So.
and I think a lot of people are wondering, when can I get access to this? So I understand it's in phase 2, so explain to us the phases of trials and when something might get FDA approval.
So phase 2, it is not out for, enrollment to the public, but I think next year, FDA, once they get all the regulatory documents and all the approval, then hopefully early 2025, we should be able to make it available to the public. So
possibly in a year or so.
Yeah, maybe.
That's pretty big.
Yes.
So I'll be keeping an eye out for that and
Absolutely.
following the studies as they continue. But yeah, if you're interested, again, this was a clinical trial on male birth control that is a form of a gel that you put on your shoulder. Very interesting.